It's World Pharmacists Day, and we want to take this opportunity to show you our appreciation for all the support given to us every day by community pharmacy. Now, let's hear from a few of our friends and colleagues about how pharmacy has helped them.
One thing I feel like we take for granted is we're living in a country where you can just walk into a place and speak to a clinician straight away. And I feel like having that element of support and having that ability to be able to walk into a pharmacy and speak to a clinician to get advice on kind of minor ailments or medication or even on complex conditions or anything kind of health related is really reassuring. I think the pharmacist plays an amazing role in just being there to kind of comfort you, support you, and give you relevant advice as and when you need it.
So for me personally, I think the first time I really had to rely on a pharmacist was 2 years ago. My stepfather had a stroke. He went from being a very fit retired badminton instructor, used to walking every day, doing the shopping, everything basically, to someone who's now unfortunately become housebound because he's no longer mobile. He's also an epileptic, which is obviously another complication, and he relies on a lot of medication to control the symptoms of his stroke and also for his epilepsy. I've had to come to rely on my local pharmacy to supply all his prescriptions. I've now become his point of contact to come and pick everything up and make sure he has everything on time without fail, because some of the drugs he takes are obviously controlled drugs. I have to say my local pharmacy have been absolutely fantastic for this. Fortunately, his walking was the only thing affected. He's completely regained his speech, his intellect, and his infectious sense of humour.
I'm a pharmacist, and although my work is now mainly with EMIS, I still practice in pharmacy occasionally. I've actually got some great examples of the valuable interventions offered by pharmacists from my own personal practice experience. I remember a patient attending with concerns about a spot on his head. He saw the pharmacist, who immediately recognised this as something more serious than a spot, referred him for an urgent appointment to his doctor for the same day, and he was diagnosed as having skin cancer and received treatment a lot sooner than he would have without the pharmacist's intervention.
From everyone at EMIS, we want to say a massive thank you to the community pharmacies for their endless help and support. So thank you for turning up every day, ready to serve.
Thanks to all the pharmacists out there. Thank you for your hard work.
Thank you to all our wonderful community pharmacies.
Not only me, but everyone should be saying a massive thank you to pharmacists and their pharmacy teams across the country. So yeah, can't thank them enough.
A big thank you to all of our community pharmacists. We really appreciate everything that you do.
I just want to say a big thank you to all the community pharmacists and pharmacists out there helping people like myself and families across the UK today.
A massive thank you to all the pharmacists out there. Your role is often unsung, but we never take it for granted.
I'd like to say thank you to all the pharmacists that are out there, the ones I've met and the ones that I've not met yet. You do a fantastic job supporting the NHS, and long may you continue. Thank you.
So from me, I just want to say a big thank you to all my pharmacist colleagues out there. You do an amazing job, so keep up the good work.
I just want to say a massive thank you to all the pharmacists out there. It's just so nice to have such caring people out there, doing right by their patients and serving their community. So genuinely hats off, and thank you so much for all the hard work and dedication that you put in to really improving the care in your local community.